My name is Marissa Ford. I am a grad student at Eastern Illinois University and I'm studying nutrition and dietetics. And today I will be doing a summary presentation on the gut-liver axis analysis. So first I will talk about some statistics on alcohol. And according to the National Survey on Drug Use and Health in 2015, 86.4% of adults in the US have consumed alcohol at some point in their lives. And also in 2015, approximately 15.2 million people in the US had alcohol use disorder, and that is also according to the National Survey on Drug Use and Health. And alcohol is actually considered a group 1 carcinogen for cancers in the GI tract, the liver, the breasts, and the pancreas. And this is according to the International Agency for Research on Cancer. And as a lot of you do know, alcohol does have many short-term effects, but it can also have many long-term effects if it is misused. One of the diseases related to alcohol consumption or misuse of alcohol consumption is alcoholic liver disease. And in alcoholic liver disease, or ALD, there's an increased level of bacterial endotoxins circulating in the portal of the liver, and this could also result in gut-derived toxins. And this is one of the major factors in this disease. And during this time, there is a lot of fat buildup, inflammation, and scarring. And the consumption of alcohol actually will disrupt the intestinal epithelial barrier and therefore will increase gut permeability. And also in this disease, there's an alteration in the gut microbiome by a prototypic derived inflammatory signal from LPS, which is a bacterial endotoxin. And this contributes to the inflammation in alcoholic liver disease through a receptor called TLR4. And the TLR4 creates hepatic inflammation by inducing the expression of genes that mediate inflammatory responses. And according to the CDC, or Center for Disease Control and Prevention, in 2014, there were 19,388 deaths in the US that were related to ALD. And in 2015, there were 20% of all liver transplants were related to alcoholic liver disease. And that was also found by the CDC as well. Treatment for alcoholic liver disease usually involves medications, lifestyle changes, and surgeries. Cirrhosis is a late stage of scarring in the liver. So first you have ALD, and then if that's not treated at the appropriate time, then it will lead to cirrhosis. And pretty much what happens is the scar tissue is replacing the healthy cells in the liver, and the scarring can actually block blood flow to and from the liver, which can result in organ failure. It is usually irreversible, and the gut microbiome is altered as well, and it's also contributed by the ALD, or the alcoholic liver disease. And ALD is usually the leading cause of cirrhosis. And the treatment usually depends on the severity of the cirrhosis. I believe there are like 3 stages of cirrhosis. So the first stage, there's usually more treatment for, but the farther the stages go, the less treatment you'll have, and it will usually lead to liver fatalities. So how is the gut related to liver diseases, such as the ones that I described? The gut microbiota is composed of trillions of bacteria, and they total to about 1 to 2 kilograms in mass. And the gut microbiota changes are important when determining the occurrence and progression of chronic liver disease related to alcohol, non-alcoholic fatty liver disease, and cirrhosis. A lot of the studies that have been done on these liver diseases are done on both humans and animals, and they have been done by testing the stool, the colonic mucosa, and also saliva. Microbiota changes can also lead to altered brain function, which the gut-brain axis is the potential target for the risk of alcoholic relapse. So this picture here is a perfect representation on how ALD, or alcoholic liver disease, can be correlated to cirrhosis and many other factors that lead to alcoholic liver disease. Alcohol consumption can lead to gut permeability way before the development of liver disease. So this shows how ALD can lead to complications that can progress into even more serious complications such as steatosis, cirrhosis, hepatitis, and even death. So there have been some studies that show some therapy that can manipulate the gut microbiota, and some of these therapy options can be fecal microbiota transplantation, which is where they use stool from a healthy donor to a recipient with a disease that is believed to be related by an unhealthy gut microbiome. And they infuse this in the colon, or they deliver it through the upper GI tract. And fecal microbiota transplantation, or FMT, has been used to treat recurrent Clostridium difficile infection, or RCDI. However, this does need to be closely monitored. So characteristics of a healthy microbiome need to be determined in the healthy individual, and there needs to be assurance of safety of the patient receiving the transplant with respect to long-term outcomes of this transplant. Also assuring that oral ingestion is equivalent to the more widely accepted colonoscopic infusion are issues that need to be addressed. So there are some barriers to this, therefore there needs to be a little bit more research and studies on this transplantation. Another therapy option is probiotics, and the reason why there is a question mark there is because it has been successful in some studies, but there just isn't enough research on it right now. But in the studies that have been successful, it has been known to improve liver function, and in relation to alcoholic liver disease, and it also suppresses the pro-inflammatory cytokines as well that are found in the liver. And that is my presentation. Thank you very much.